Morning, good morning, everybody. Thank you for our activity today, for attending our activity today. I have put on our chat how you can get CME credit. You have to go to a website, enter a code, and then enter your name and license number, and you'll be able to get your CME credit as long as you do this within 7 days. So that's all in the chat. So please follow those instructions. It's my pleasure to introduce Dr. Gerardo Ferrer, who is the director and chairman of our psychiatry residency program. Go ahead, Dr. Ferrer.
Is it on? Yes?
Yeah, it's on. It's on. Go ahead.
Okay. Can I get this out of the way? Good morning, everyone, and welcome, and thank you for coming to CRCME today. We're going to start off the day basically discussing something that affects physicians largely worldwide, which is fatigue and burnout. And we're going to discuss mitigation, what precipitates it, what are the reasons, how to go about it, how to help, and how to mitigate once somebody's burnt out. So the objectives today is basically the critical issues about physician burnout and fatigue mitigation. What are the contributing factors and consequences, the impact of burnout and fatigue in the healthcare system, and practically strategies that can prevent fatigue in healthcare professionals. Fatigue recognition and mitigation. So what is fatigue? So it's basically a subjective feeling of tiredness. The individual starts to feel tired, drained. It can be physically and mentally, and usually starts kind of physically. Nevertheless, take point that mental exhaustion is basically stronger than physical exhaustion, which can lead to fatigue. And we're practically as physicians, nurses, mental health workers, tech. We're constantly going using our brain, and it can be draining, and the physical effort that it has to go along with that. It can be acute, it can be or chronic. It can be something that somebody just gets fatigued over a shift. They're doing a call and they become fatigued. Put strategies in place in a lot of institutions and programs where faculty, peers can notice the symptoms and basically can get someone and put aside, like, okay, don't drive home after a shift, why don't you rest for a little while? And it can resolve, take a day off, take a wellness day. But when it's chronic, it can become a bigger problem because it's a constant dread of someone feeling exhausted and drained all the time. And I'll tell you a big difference where you can go between your fatigue and a burnout as I go along. And one of the things that it's greatly affected is cognitive function, which starts to deteriorate, and more than the already said, the physical performance. Common causes of fatigue: inadequate sleep, fragmented sleep, less than 6 hours. When this starts to happen over a period of time, it starts to become more and more prominent. That's when it builds on, and the individual starts to feel fatigue. And like I said before, it can happen to anyone in just a one-time setting. A desynchronized circadian rhythm, night shift workers, and you have night calls and then you have day calls, and that can disturb the circadian rhythm. Not eating throughout certain times of the day, and then other times disturbing the sleep and disturbing how it is perceived our daily function by our circadian rhythm. Prolonged physical and mental activity, working long hours, looking into patient care, draining, in long calls, assuring that everything labs, everything is well analyzed, it can take a toll on the physician or other healthcare workers. Someone is depressed, anxious, excessive stress during work. It can also lead, less coping mechanism can lead to symptoms of fatigue, and individuals who are suffering from sleep disorders, where it's getting disturbed and then have to go on long hours of work, and this can affect them greatly. How can I move this? Okay. Fatigue in physicians. Physicians often experience fatigue. The expectations for physicians are very high in both ends. We tend to put high expectations for ourselves, where we have to pace that and be realistic. And the other side of the coin, there are excessive expectations for physicians, in part not just of their employer, but in part also of patients. You have a family member that's sick, or yourself. You want the best for them or for yourself when you're in a hospital or you're taking care of in a clinic. And providing medical care to patients can be, like I said, physically draining and mentally demanding. But to an extent, experiencing fatigue is supervised in a supervised environment during training prepares the residents for managing fatigue in practice. What is it trying to say? Okay. If we wanted to have some sort of stress in our lives, and we learn to manage it, we wouldn't have been where we are today. Not just as physicians, we're still being in a cave, as humans, to evolve, we've gone through a lot of stressors, and learning to manage and cope and have resilience with the stressors is part of the experience of training to become a physician. Of course, that doesn't mean that is something that you're gonna submit, constantly, because that is counterproductive. But there's some level of stress, some level of fatigue, and learning how to cope with it. It is important. Okay, so you might be fatigued if you experience any of the following symptoms. Okay, so if you notice yourself, you having narrow attention span, forgetfulness, reduced performance standards, you expect to do certain tasks during a period of time on your shift and it's not getting done, not finishing notes, dragging orders behind, experiencing signs and symptoms often seen in depression. Okay, it can get even to a lack of motivation, even some feelings of sadness or inadequacies during the moment when the physician or the healthcare worker is feeling fatigued. And that can impair judgment and decision making, okay, which at the end is going to affect patient care. Physical symptoms. In physical symptoms, you're going to have fatigue, sleep, unexplained headaches, muscular aches and pain, blurred vision, loss of appetite, poor concentration, sometimes if you compare it to a generalized anxiety disorder, kind of a milder way, you can kind of pinpoint, symptoms of fatigues physically. Okay, so fatigue mitigation tips. Okay, things that we even explain to our patients ourselves, right? So you got to eat right? Avoid heavy meals before bedtime. That's like a sleep hygiene. If you eat very heavy, before your shift or before you're going to be drained, or before bedtime, you're not going to get a good quality structure sleep, even if you fall asleep cycle. Regular exercise. As we exercise, our body's building substances to help us deal with stress. It regenerates, it rejoices, and you're taking care of yourself, which is important. Understand your alertness and sleep patterns. Okay, so you have to. Sometimes physicians have poor cues in the sense that we have high expectations for ourselves. So what happens is we're feeling fatigued and we're not noticing. We keep on. We think it's just a natural feeling that it's embedded, or it's supposed to be within us. But it is important to have alertness, just in case, for example, like I said before, you're going to drive after a shift. It's best that you're honest with yourself and say, wait, let me take the time to then sit on the side to go to one of the rooms that are provided in institution and get some rest and go from there, or reach out to someone to help. Okay. Um, so you have to be alert of these things so you can act upon it. Um, this physicians' work hours can be long, unpredictable, and it's challenging. It is challenging to prioritize sleep. So this is easier said than done, right? Develop a bedtime routine. Well, you undergo in a residency. There are certain work hours and then there's protected time where or shift schedules, and it can become difficult to establish a routine sleep. And some individuals with mental disorders, this is practically something that really helps. Affecting the circadian rhythm. And in those individuals, you have to put certain, it's a must. With us, we have to attempt to do the best we can. Create a sleep-friendly environment. For example, if you finish a shift and you go home, like a resident that I had, and the neighbor is constantly practicing their drums in the middle of the night because it's the time that they have. So imagine, imagine that. You got to move. It's hard. Or family members or anybody, roommate, not allowing you to get a restful sleep. Try to aim for 7 hours. We say 8, 9 hours of sleep. Some of us sleep 5 hours. We get 6 is a blessing, but in reality, to really set your sleep cycle where you have a restorative sleep, it requires around 7 hours of sleep. Okay, at least to get that. And limit certain activities before bedtime. It's a part of sleep hygiene. You get home, so outside in case if you're tired, nevertheless you you're active and you start reading articles or start reading any type of medical news or literature. And at that time that it seems productive, but it can be counterproductive. Or watching TV or trying to find ways to cope and relax by watching TV or going and watching some podcasts, and that can affect. Uh, this basically what I just said. Avoid stimulants. One thing that I tell residents is, and they go around, drinking coffee. I understand in the afternoon. I said, you shouldn't be drinking coffee after 11 a.m. Sometimes I tell them, I know, I understand in the afternoon. Try for 1 p.m. But instead of having a full blown colada, do a mild cortadito or something like that. Something that is not too activating because it has a 24-hour half life and it's going to continue on throughout the night and day. Much less, but it's going to continue on and it affects a lot of us. Alcohol. Alcohol is a big one. Some individuals resort to having oh no, I just have a cup of wine, just scotch right before I go to sleep. That's going to disturb the sleep cycle, and as days goes on, that's going to drag on, and it's going to be counterproductive. It's going to affect you, and at the end of the day, it will lead to fatigue faster than if you were just not sleeping or difficulty, having some difficulty sleeping. For that, you got to go and seek help from a professional. And heavy exercise, 2-3 hours before sleep, because the majority of us, some, nothing set on stone. Some individuals might help, but the majority of us will get very activated after doing exercise prior to going to sleep, and we will not be able to get rest. Okay, now let's get into burnout. Now you're going into deeper waters here with burnout. In contrast to fatigue, you start with fatigues, may not, and at the end, it becomes something that, if you want to differentiate it, this is more so not a temporary, even though fatigue can be chronic, but there is a big, large emotional toll. There's a big, large emotional toll, and the emotional toll can lead to be pathological, and that pathological state will lead to more severe outcomes, which we're going to talk about further as we go along. So the syndrome is characterizing professionals that involving demanding interpersonal interactions. So like I said, most of the draining is when you're having mental exhaustion, and basically when you're not interacting well with others. So it takes two to tango, right? So it's a part of us as physicians trying to find strategies, not for us not to be led into burnout, and at the same time the institution finding strategies to implement certain practices that will limit burnout in the healthcare workers. It's a chronic form of tiredness that occurs due to prolonged periods of emotional stress. All right, and work related, especially work related, because you can get burnout in a household. You know, imagine if you're having a hostile household, that can lead you to burnout per se in that setting. But we're talking about the workplace, and you see, as you see there in top, healthcare professionals. Okay, so let's understand burnout in the medical professional. It is an epidemic. Okay, it has become an epidemic. Even as I go along and show you some statistics, several years ago, those statistics within specialty was different from post-COVID. So COVID has affected also very much to this in certain specialties, but among overall every healthcare worker. And look at this, 400 physicians commit suicide every year in the United States. Yes. 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 And women physicians, you know, are 2.5 to 4 times overall rate of suicide compared to males. And let's not blame females here, because also one of the things that's being prominent, we don't have it on the slide, on female physicians is the use of alcohol, you know, developing alcohol use disorder. On my reviews, you know, on articles and research that I've done, what I've noticed is not gender per se. It's just that we feel that we're getting, you know, compared to previous years, a lot of female physicians are being trained. We're getting more and more physicians. You know, in the past, you know, more narrow-minded. Now we're being more open-minded. So, you know, they love the profession. You know, great, and they're there, and they come in with high expectations. You know, still, you know. So I think one of the great things to do is, you know, understand that. You know, and you know, with a good supportive work environment, you can limit that, because it's just because the amount of females that we're getting as physicians. Depression among residents is 29%, and that's 3 times the rate of the public population. And studies have revealed that residents experience burnout ranging between 41% to a staggering 90%. Okay, and like I said, that can go higher depending on the specialty that they are undergoing. Another study shows 63% of physicians report signs of burnout at least once per week. Okay, right? You know, burnout. Well, we'll get more into that. There's, you know, different aspects within burnout, and you might not be fully burnout yet, but you're having more signs or symptoms on certain areas of aspects of burnout that are being present. So that, and I'll talk about that, that's a good way to cue yourself, you know, to cue yourself and help yourself, and us help others that are undergoing burnout. And the ACGME work hours impact. Okay, so in the past, like I have several faculty members, you know, professors, you know, were my professors, and you know, back in the days they used to work 56 hours straight, you know, very long shifts, you know, 24 hours, and then continue on to the next day. And ACGME has implemented a lot of strategies to limit that, you know, limit it to an 80-hour a week work, limiting to certain shifts depending on specialties and PGY level, you know. But what's been noticed is that even adhering to those work hours, the symptoms of burnout have not been uh, have not substantially decreased, you know, only lightly. And the reason for that is because, like I said, there's a big emotional component and other factors that can lead to burnout and not just exhausting long work hours. So this is what I was mentioning before. As you can see, you know, critical care, you know, before we will see other specialties, anesthesiology, you know, even emergency medicine being in the top of, but, you know, critical care, it's a big one. And critical care is a big one because it's where we're seeing a lot of not just physicians, but especially the nursing staff, you know, in ICU units and things like that. They are NICUs there, especially NICUs. They're getting um, extremely burnout, worse, leading them also to a high rate of mental illness, you know, and suicide. And you know, because I want to mention the one of the things that we don't perceive as physicians. Physicians were used to, you know, the stigma that we cannot break, that we should quiet things down when we're feeling exhausted, when we're feeling tired. It's part of our life. We've been living it through medical school, um, you know, pre-med, all throughout, you know, studying for harsh exams. So it's like a stigma that we say to ourselves, no, 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 no. You know, we keep on going. But the thing is, there's a very fine line between uh, burnout and depression, and that's when the issue can even become even worse. Okay, um, 15,000 physicians from more than 29 specialties report on a survey. Well, that's about prevalence of physician burnout. This is what we got. 42% of physicians reported that they are burned out. This was down from 46% 6 years ago. Um, so, you know, a lot of strategies that are being implemented, you know, uh, and resources out there are working, but that's not a big number either, you know. And so we need to understand this a lot more, and you know, it can even become part of a mental illness. Maybe we see in this DSM-6, or because it's substantially affecting us. What is burnout? Okay, so the signs and symptoms of burnout. This is a nice slide. You know, there's different, and this you know, puts it well, because these are like the three pillars, you know, there of affecting burnout. So exhaustion, depersonalization, and low personal achievement. Um, and I'll explain it now. It's exhaustion is more so, it can be physical, right? But once you get into burnout, it's actually an emotional exhaustion. Okay, we're working hard, so we're striving to reserve our energy, right? To find reservoirs, or like not 6 months off, but sort of like a bear. You know, you go and you hibernate, right? And it's not really hibernating. It's finding strategies and that begin with coping strategies to deal with the situation. Uh, but it takes a toll because it becomes an emotional exhaustion. Okay, um, and that makes the individual, and what it's trying to say there is they're not going to be up to the psychological level of performance. Okay, if psychologically, you know, mentally, you're not feeling a sense of well-being, you know, you're feeling emotionally drained. Imagine that interacting with patients, you know, and how they're going to perceive it, you know, and coworkers. Okay, you have depersonalization. So this is basically, you see, it's negative cynicism attitude. So this one is like, okay, you detach. Okay, so you find kind of a mechanism where you detach. You know, you're indifferent. You know, a patient comes to you and you're seeing like a number, like a face. You know, okay, bring the next one. Okay, bring that. You don't. You start not to care. You know, but it's within. You know, not something more of an unconscious process. You do the same with your coworkers. This can happen even to for all aspects and levels. It can be a supervisor, it can be a regular coworker, worker, where there's no feeling. It's a total detachment, total indifference to situations that are happening within your work facility, your work area, your coworkers, your patients. And so imagine what will happen at the end, okay? And who will get affected at the end more than everybody else, the patient. And you start then at the end to feel, as stage, you start to feel a sense of reduced personal achievement. So first you're feeling emotionally drained, then you start to detach, and then what happens is it can get to a point, if you don't have individuals with either low resiliency or the stressors are so severe in the work environment, leading to this, and then at the end, the person affected is going to have a sense of low achievement. Am I good enough? Am I doing my job correctly? Starts doubting themselves, and that's a very uh, uh, risky weapon, or double-edged sword, towards the work that we're doing. We have to be confident. We have to be confident on what we're doing, so we can and know when we need to go further and push ourselves to do more with the type of work that we perform. And these are the signs. So, for example, appearance, performance, growth tension, affect control, and relationships. So, you start seeing someone who is either losing weight or gaining weight, not taking care of the hygiene, not dressing appropriately, a professional. The performance can start to decrease, or the other way around. You get to workaholism. The person is working and working and working, but there's it's a purposeless aim towards what they're doing. They might engage in things that are not really something that's purposeful. It's just taking care of a patient way too much when there's a whole bunch of other patients that really need you, and this individual is intubated in an ICU and it's not even looking at you, and it's like, okay, what are you doing? It's like, move on and go to the next one. Take that in mind. So they'll start engaging in things that are being unproductive for the patient, for the institution, and for themselves at the end. This is sort of like what I was talking about with you start feeling overwhelmed, and you start tension starts to grow, so you start getting cynical attitudes, okay, and moodiness. They can get irritable, snap out of anything, irrelevant things, and they have difficulty managing their emotions. And relationships, they have, they'll start to isolate, become, let's, why don't we go have lunch? Why don't we talk? No, yeah, and they start to isolate. They have struggles with the relationship with their coworkers, and at the end that will affect them. Okay, so like I was saying, this is the stages. So first, basically, it's a chronic emotional and interpersonal stressors, right? And go to these stages. So the first stages has more to do with exposure. So there's a wide range of stressors at work, which start to deplete the reservoir, okay, and it starts to affect them. But the physician, the healthcare worker, still doing their job, right? But it's little by little start to become detached. And they start questioning their own effectiveness and the value of their job. If what I'm doing is really something, what I study for is a really helping others. Am I making a difference? And then you go to stage 2, which is a stage of reaction, right? So at this stage, basically a depleting reservoir elicits an active or passive response, right? And that's where they start to employ those coping strategies. So basically, you start to resort to apathy, to defend against depletion reservoir, purposeless effort, what I was speaking about before, and to replenish it, and basically, it depends on the standard resilience, like I said, for coping strategies. And stage 3, so it's determined by whether coping strategies have been successful in replenishing the depleting reservoir, right? So, that's why it's important to catch a burnout earlier, okay, early on. So you can help yourself, and others seek for help, or others, watch out for your peers, so you can step in and help. Okay, and then this is when the stressor exceeds the rate of replenishing with coping strategies. So there's severe stressors that are constantly on or building on, present, really present in the work environment, where it overwhelms the coping strategy of the physician to be able to pull through with resiliency, and those coping strategies to be successful. It's just, swimming against, current. And once it drops to critical levels, it results in burnout. Okay, there's different rates of burnout, severe burnout, but basically once it gets into burnout, that even if it's different stages, that's detrimental. Okay, and that's when the reserves drop below a critical level. Okay, there's no reserves anymore. It's right. And of course, this diminishes mental health, and the person can lead to a depression, other mental illnesses, which I'll go along, and compromise patient care at the end. Okay, so contributing causes, length of training and delayed gratification. I want to do this specialty. Well, it's 8 years. Do you, because also you can be setting yourself up if you have false expectations or higher standards that are beyond what that individual can do. So it can be something that you can set up yourself for, or something that can happen on its own due to severe stressors. Long working hours and enormous workloads, imbalance between career and family. We as physicians love to work, and we love what we do, and we sometimes even take our work home, but we do find joy in family and friends, and our hobbies and activities that we do beyond that. And it is important not to fall in a web where you neglect that, because then it will lead you more so into diving into the waters of burnout. Feeling isolated, a loss of time to connect with your colleagues, right? So much work, so much work, so much work. Okay, you're doing some type of specialty where it requires a very high pace. Okay, well, that happens during first year, that happens during second year. Okay, so yeah, that can lead to burnout per se, that can lead to fatigue, that can lead to many things. But when that goes on for a way prolonged period of time, that where you set your short-term goals, then that's where the situation can happen, and you don't want to go to a workplace where you cannot even say hello to someone, and you're just constantly working. Financial issues, salary, budget, managed care, so these are things important. That's why an institution we built, a salary, a budget for certain projects that someone might have in the workplace, health insurance, and all these type of things that we have. Grief and guilt about patient death or unsatisfactory outcome. That's why it's important. For example, if I see something that happens with a patient, I remember about a year and a half ago, it was a minor thing. The patient, nothing really happened, but one of the residents got a little bit of autonomy to do something. It was like an ETO kind of thing, and it's an ETO, and had to act upon it, before even discussing it with the attending. And basically, was freaking out with what happened with the patient. I got this, and don't worry about it. Let me let's put this medication. But the first thing I did when I was about to walk out, and let me get the resident, I brought him to a side. He was very distraught that harm someone, because we're very caring. That's why we do this job, right? Nurses, physicians, we're very caring. So if something happens to our patient, it's going to affect us. So it is important, to give support to your peers, to students, to residents, any coworker, a nurse, anything that happens. Immediately pull them to a side, reassure them, look into the situation, and provide support. Inefficient or hostile workplace environment. So if you get into a workplace where constantly you have a boss screaming at you, demanding, where really it's not gonna be productive towards the the employer, or individuals bringing around gossip, or something happened personally to that individual, and it's sort of like an emotional bullying kind of thing that we're seeing nowadays, and that takes an emotional toll. And even if the physician is not drained, then they're going to be emotionally drained, and then that's going to drain them completely and become a burnout. And like I said before, the setting of unrealistic goals. Okay, so be honest with yourself. What you want, what you can do, and speak to your supervisor. If you're a resident, to your program director, your chief, whoever, your bossman, whoever you need to talk to, support groups, peer groups, to help that and guide you. As a mentor. That's why mentors are so important nowadays. When you're doing interviews for applicants, before you didn't hear this, but in the past few years, is they ask, "Oh, how's the mentorship? How the mentorship works? How many mentors?" So it's important. So burnout and psychological risk. So look at this funny thing, right? So the doctor is trying to attempt to see their patient, and she tells her, "I feel the way that you look." And look at the doctor. So anxiety, anger, poor sleep quality, alcohol abuse, things that I already talked about. This is very important. PTSD, you're a subset of burnout. 21% of nurses with burnout carry a concurrent diagnosis of PTSD. This can be with something all the way to having a patient that you lose, an event that is very traumatic. That's why critical care, what I was mentioning before, can lead even to a PTSD. Okay, post-traumatic stress disorder. But it can be also, sometimes they're jumpy, or reactivity, right? So how many calls are you getting, in a shift? How many, even after the shift, how many, and then it becomes to a point that, you see them changing the ringtone. now you're calling someone and they put it like in silent, and you're like, okay, am I getting through this person? Or, honest, because at the end you say, wait a minute, what's going on here? Maybe it's getting way too overwhelmed, and that little ring, or can become, or if you have, like I said before, hostile supervisor, right? Who's not managing things correctly. So every time you hear that ring, on the other end, what you're going to get is not a support system. You're going to get somebody that it's going to be attacking, and that can create, if it prolongs enough, it can lead to post-traumatic stress. Unprofessional behaviors. The individual can start so irritable and taking such a toll emotionally that it's interacting with others. So sometimes we see, oh my goodness, look at this person. How unprofessional. Look how they talk to me, right? It's like, wait a minute, you should take a step back and see what's going on with that individual, right? Individuals is part of an employee. We actually researched, a curriculum. If the individual especially was working exceptional before, and then you see a different type of behavior, that's like a fast red flag. Why don't we first pull this aside? Let's see how we can help. Okay, they lose empathy. I was saying with cynicism, and that also self-esteem. They start doubting themselves, and that's a big problem. There's social physiological implications of burnout. I remember we did a study once ourselves are in the hospital with heart rate variability and with individuals, which not practically, burn out, but, under a lot of stress, residents actually, right? Um, so you can have a lot of cardiovascular risk that can develop. All of a sudden, the person starts developing hypertension or, cardiovascular disorders, and risks. And it's this associated with cardiac hyperactivity during conditions of stress and recovery, right? So what's going on is, for example, in this study, um, autonomic recovery from stress. So some individuals with different levels of burnout, right? So they have different levels of burnout. They're severely burnout, lightly burnout, are put in a resting condition, supportive condition, right? And when you measure, the cardiovascular factors, right, they're going to be appear equally healthy. At the end, the variability is going to be more or less the same. But under stress, okay, the individual who has a high level of burnout will display. So you put them now under stress, right? And the one that has the higher burnout is when you're going to notice at that moment the increased cardiac reactivity. Um, and this is why, it alters the autonomic nervous system and cardiovascular function. Increase sympathetic tone, blood vessels, so things that we know are going to start contracting, your heart rate going up, more cortisol. And imagine that cortisol level high all the time, right? That we see a lot of me as a psychiatrist, a lot of mental illnesses, that individuals per se have high cortisol, and this is what's happening with someone undergoing a burnout. Cognitive function of burnout. Okay, so they have a causal relationship, right? So burnout and cognitive function. Okay, so basically what is happening is that during burnout, right, there's areas of the brain that are going to be activated, right, and not necessarily positive. It's going to be activated, being downregulated or deactivated, right? Like in the dorsolateral prefrontal cortex, right? So we got executive functioning there, right? So what happens in this cortical regions, right? We make decisions, critical thinking, things that we need to be sharp on to do a healthcare, right? And it is suggested in study that is, the individual starts having poor concentration, lack of attention span, because these areas are being affected undergoing burnout, and then they require a larger effort to be able to understand, to work through something that before it will take them several minutes, an hour. Now it's taking excessive time. It becomes very difficult to concentrate. So it's like an embedded severe ADHD on an individual or something else, sort of similar. And what happens is that a patient care is going to be suboptimal, no brainer, and there's going to be medical errors. How to aid someone experiencing burnout? Okay, so pay attention. The warning signs, right? As I was saying. And provide professional support. So common behaviors: increased irritability, like I said, getting withdrawn, impaired judgment, excessive alcohol. This is what I was saying before. So they start, building a coping strategy. Oh, I need a drink after the day. Well, a drink after the day is gonna kill you if it continues on for a very long period of time, or the drink becomes 2, 3, 4, 5 drinks, or any other substances, any other substances that they will use to relax, or to pep up. Reduce ability to manage emotions and impulses, like I was saying, and decrease personal. So when you're seeing this, ask them, how you doing? What's going on? How can I help? Be supportive. Don't say it. When you go help someone and you see that in patients, and I tell my residents, oh, how come that, that guy was so aggressive, schizophrenic, and came around, no? And this, believe it or not, more so than us, mentally ill patients can perceive when you care. You see, they have very bad cues. You're laughing, and they might see you angry, that's why they're paranoid. And somehow they can perceive when you care. And so would someone with burnout. They will perceive when you really care, when you're coming really, not, okay, how can I help? It's just, the protocol, I have here the paperwork, no, really care. Bring them over and help them. Advise them to seek help, give them the resources. come together, stay connected with them, don't just, it's not a one-time thing. And if, you see that it's something that you can involve the team, the other around to motivate, to help, to provide support. Okay. And doing that early really, works. We still need this. It's still an area that we're still researching. It's something new, but it does have results when you do that early. Consequences of burnout. Okay, so for the clinician, you have a higher incidence of depression. Okay, which then what we talked about, 400 physicians commit suicide, so that will be, it's a suicide risk, right? You become depressed, a very thin line between burnout and depression, and the physician is not aware. Oh, I'm burned out, I'm fatigued, or am I depressed? They don't know. They don't know. That's something that's why it affects us, and that's why it's such a high rate, because the physician is not able to perceive this. That's why this presentation is important, because we're not able to perceive if we're burnt out. We think it's, I shouldn't be feeling sad. I shouldn't be feeling like that. I'm a physician. I'm too great for that. Resort to substance abuse, and then they start having relationship problems, right? So you all burn out and start not to give out in the workplace, and then imagine when you get home, right? So it's not a relaxing environment anymore that you wanna, right? You stop meeting the duties that are required for like family environment, significant other, friends, and the patient. The patient, there's an increased risk of error, like I said, right? At the end of the day, this is a very substantial factor, because that's what we do, and it's human beings, and if we get affected, they get affected, right? So increasing medical errors, and the patient, right, is less likely to follow treatment plans, right? If you're not engaging well, like I said before, the personal communication with the patient, you're cynical, you're detached. Okay, so here, get the script, take that 2 times a day, should I take that 2 times a day? Right? Should I? If they told me that, I was like, wait a minute, let me research this first, right? So if you tell them with reassurance, they trust us, right? We're an authority figure. There's someone physicians are someone that if everybody out there look up to, if they're patient, they want to trust them, right? Build a trust, right? A patient told me yesterday, this happened to one of my family members. Nevertheless, the other family member has been with this other physician for 40 years. Well, there has to be some type of real bonding and trust, right? And they will have, due to that, lower satisfaction with their care. I don't feel I'm being treated correctly. They'll feel let down, the patient. And in the healthcare system, you have higher litigation rates, of course. You're neglecting. It can lead to lawsuits and things like that. Lower quality scores for the institution, for the physician per se, for the clinic, and higher cost, due to lower productivity, get the patient, whatever. The patient comes 50 times more, or the patient is not improving, because you're not trying to hit a target on what's really happening with the patient to give the right medication. So now it's like, no, this new medication come out, put that. So, it's a $4,000 medication. You can resolve it with that one, that's 10 cents, and that's a big situation, right? And other costs that happen that affect the institution as well. And this is a nice, the same thing that I just said, but it's nice to see what's in the center there, right? Like if you're playing one of those start things, right? Patient well-being. It doesn't say physician, it says patient well-being. So what we do at the end, who's it going to affect, right? What is it that we do? Who is it that we're caring for? It's them. So that's what's going to be at the end mainly affected. And the relationship, right? The clinician well-being, which is being affected because of all of these factors, okay, leading to the burnout and lack of well-being, and the lack of well-being in the clinician will lead to lack of patient doctor relationship or clinician, and then the patient will get affected. Okay, mental, physical health, and burnout. So It has gained public health relevance. It's a growing concern currently, so it's being highly looked at. Has multiple psychological and physiological implications, like hypertension associated with poor cognitive, same. And working environments, personal relations play a big role in burnout, right? So if you don't have a good interpersonal, it can go, either way, right? If you don't have a good interpersonal relationship, whether it's you being burnout or it's your coworkers that are not someone that is supportive, and the work environment is hostile, not supportive, that it takes. So interventions to prevent burnout. This is highly needed, because it's affecting us greatly, like we said, and our quality of life, quality of the patient care, right? So tips: how do we deal with burnout, especially in residency, huh? So leveraging mindfulness training. So you can go to mindfulness training. Sometimes we attempt to do workshops during the active sessions. This is something that substantially it helps. It can be anything. There's a lot of studies that when individuals pray, for example, someone told me, "What about meditation?" And there was somebody else and said, I like going to the church. I said, well, it's a sort of meditation. There's been a lot of studies that there's areas in the brain. How do I get back to this? Sorry. How do I get back? There's areas of the brain that become activated when you're meditating, or I got it. When you're meditating or you're praying. Okay, so that will start releasing a lot of substances, neurotransmitters. So like you taking an antidepressant or accent, where it helps you cope and deal with situations better. Okay, and rejuvenate. Reducing stress at work. So finding strategies to reduce stress at work. What's causing the stress? You got to do a root cause analysis. What's causing the stress, right? Is it individually or is it a unanimous thing? And then implement strategies to try to reduce that. Implementing self-care. You got to care about yourself. Try to sleep right, exercise, and it starts there, right? Starts there. You don't care for yourself, how are you going to care about others, right? Surrounding yourself with the right people, right? So you have a good team. This is a good team, right? Or not that. Don't take that into. You see somebody that's being negative, maybe they're going into burnout. You got to try to help out, right? So there's some type of association that's why we're so prone to burnout, because you're always trying to help others, and you have your resiliency, and even attempting to help others can drain you. But surrounding yourself with the right people that can help you, right? Regular exercise was part of self-care, prioritize sleep as well, meditating, like I said, and breathing exercises. And these, now we're going to talk, finalize about resources that are out there that we have, so there's been a lot of resources, in the recent years, and a lot of the entities that we work with to help us combat fatigue, to help us, combat burnout, and help us. And find a work-life balance. Okay, so the APA, the American Psychiatry Association, you can log in. It's for free. You have to be a member, and they have a lot of self-tests. Okay, for example, the Alderberg Burnout Inventory. So it's an inventory. You have there the link and what you can go through, and it will tell you, in reality, not just if you're burnt out. Some of them will tell you if you're burnt out. So, will tell you what's the risk. So you see, it's catching it early. What's the risk that you have of developing burnout? Okay, so you can start building the strategies I mentioned before early, and seeking help early. These are other helpful tests that are out there. Okay, you can do, and they will help you and guide you to have a work-life balance. How to maintain physical fitness, how to do mindfulness. So there is guidance, right, that you can resort to, apart from your supervisors, your coworkers, your peers, or whatever, peer supports that we have within institutions. Okay, this is the Oldenburg, right? So it gives you a score, right? Low risk for burnout, moderate risk, or high risk, depending on the score, and how you do it. Will give you like a full a total score at the end of what your risk will be. And that's why I put this one in, because this is a one that is mostly used. This you got to pay for, but this is the one mostly with this muscle burnout inventory. And the nice thing about this one is you see that it breaks it into the exhaustion, right? The burnout, the paralyzation, right? And where's the right? And the lack of self accomplishment, right? It's somewhere there. It, breaking this there, right? Personal achievement, right? And one of the nice things about this inventory is that is sometimes when you caching things early, right? Preventive, um, you might score low, low risk in certain of the areas, but then in other areas you might be scoring higher. So, like I said before, right, it goes through stages, but nonetheless, sometimes you might perceive certain things, right, which maybe that's you can delineate. Well, this is what's happening on uh, uh, my workplace or on my team, and maybe that's why it's leading to that, and maybe here there are minimal symptoms, but in other areas maybe becoming depersonalized. Why? Well, is this worth it? Is it worth it working with this individual? Is it worth it doing this? Or maybe you start feeling with low self-esteem. So uh, I think it's a very good tool, and you have it there. You can do it yourself. You do it on paper or do your score, and it will help. It will help you give you cues. It will help you, go to a mentor, show it to the mentor so they can help you with strategies. So again, preventive strategy, good sleep hygiene, habits, open communication with others. Okay, don't limit yourself. Don't stigmatize. That sometimes sometimes the culture within physicians, like I said as well. Look for the professional resources that are out there, and find non-medical hobbies. I remember one of my residents came one day and she said, "Oh, a lot of my peers, their significant others are doctors, and uh, mine is not. Whatever. Welcome to the club. You know what I like about that? When I get home, I don't have to continue talking about, you know, let's talk about something else. Let's do something else. Even though, because we're gonna have it 24/7 in our brain. Sometimes we're dreaming and we resolve what's happening with patients. Or it just dawned on us. So find things to do so you can disconnect. Okay, so you can disconnect and enjoy yourself in a different aspect, right? Because too much enjoyment can lead us to burnout on what we do. Humor and laughter, right? Um, Humor and laughter is important. Going in stressful situations, and uh, you know you're around really with a serious face, something happened. Nice thing is to even in giving teaching points, or if you are a senior resident, with your peers, with students, the faculty is engaging, healthy laughter, healthy jokes, to promote a nice, well-being environment around them, enjoyable. Mindfulness and meditation, like I before, start monitoring your fatigue, where you have the resources so you can go and monitor yourself and check yourself, right? That's why inventories are for. Sometimes we're not seeing things and they're able to be seen by others or in an inventory. The peer support, engaging in physical activity. You see physical activity and regular exercise. Well, regular exercise is important to keep your body healthy, right? Bring that cortisol level down, and, improve your cardiac function, maintaining healthy. But there's a lot of other physical activities where you can do sort of like a well-being, and things that you can do within even the job, let me go. I have to go to this other place on campus. Oh, let me get the little cart that goes around. Or let me just walk, get the stairs. Engaging in physical activity, and physical activities that have to do with well-being. We're getting every month, which is nice. That be around. So why don't we do a softball club or a basketball club or something that we can do maybe quarterly, together as a team, right? And a balanced diet. It is very important, residents start to munch on things to get through the day, with less time, a lot of suites to get activated, but that long term can affect. Where's the okay? So you put it together. Okay, so this ACGME also has a lot of resources that you can go into. So if you go into ACGME, you can find a lot of resources, right? This ACGME Aware, this is an app, okay, that you can download on your phone, and it has like little podcasts, right? Little modules that you see they have there the titles, right? So you can go through them in 20 minutes, 23 minutes, right? And it helps you recognize things. It teaches you. It provides support as you are rationalizing and educating yourself on what's happening, and you educate yourself on what is it that you need to do if you're feeling a certain way, or give you cues on how you're feeling a certain way. This is a toolkit that the APA has on well-being, and it's a very large toolkit which includes a whole bunch of things. It includes scales, include like little videos, teaching points. So it's very large. Please take a look at it, and it can help you to with resources for you to limit burnout and help with your well-being. These are it. Thank you. Hope you enjoyed it. Any questions?
Thank you so much, Dr. Ferrer. That was really awesome and inspiring. I guess over the years, the one thing I've noticed, especially with residents, is I think developing hobbies outside. Many of them end up with a pet. They usually have an animal. Another one that I see is they frequently form music, form a band, artwork. And as a matter of fact, a few years back, there was a very popular movement called Humanities in Medicine. And the residents used to come around, and we would maybe once or twice a year just showcase. Some did pottery, some did arts, poetry, etc. Maybe it would be a good idea. I mean, I think we all know about burnout, but we also know it's been really accelerating. Maybe we should see if there's any volunteers who would be willing to think in terms of implementing a solution for our residents.
Yeah, the workshops, it's happening. Workshops really work. Yeah,
fun activities that we could do, because it's probably not just the residents, it's probably all the workers here. The nurses are probably in the same situation. Yes. I don't think it has to have boundaries, but maybe an inclusive, forum that we could work on it. And thank you so much for really shedding some light on this topic, which is so critically important and so underlearned. No one takes time to learn about how to take care of yourself. So thank you so much.
Thank you so much. It's great. Actually, I practice pediatrics. It was really tough when we were doing residency, because every time we are on call, we are like in the hospital for like 48 hours, no sleep, right? Even the transition, like when we sign out, it's a matter of hours. Then we have to complete our notes and things like this. Horrible, but luckily things have changed. Like I think a few years ago, like about 10, 15 years ago, there was an incident in New York. So now they limit the hours of work. So that is great. I think what you mentioned is like the support system. That the summary of it is a support system for the physicians. There are three. I think there are three stages of our life as a physician. One is the training, residency, fellowship. We work like slave. I mean, years, right? Then we start our journey as a physician, like as attending. That like 8 to 10 years. We run around hospital to hospital, clinic to clinic. Then after that, in the third stage, we are trying to we wind down, and we really don't enjoy as much as we should as physicians, right? So the burnout is an important topic. I think we all should discuss more and more about it. But what I want to mention is that I'm a doctor that have been involved in international health. I have, Dr. Ahmed is also as a part of that, that we do build hospitals and clinics and provide the free services to the poor people. This is one example of the volunteering, and we do host uh, lots of doctors and nurses from around the world come to our hospitals and clinic to give volunteer time, like say 2 weeks, 3 weeks, 1 week, whatnot. But there are many other opportunities. As a physician, we come to this profession to actually give and receive, not money, but give the care and receive satisfaction, right? And when we go through this system here, actually we lose that. It's
Absolutely. Yeah.
all money driven. At the end of the day, it becomes a matter of paying bills. But we should actually consciously make decision how we can keep at least a small part of that giving to people who, there are like millions of people who don't have the cannot afford the health services. If we can invest in our time in some way, we don't have to go to 10,000 miles away or 2,000 miles away. You can give time in here in our backyard, in Miami, in Fort Lauderdale. There are like the shelters and there are like the community clinics. We can volunteer there, and I think this will help us a lot in terms of self-realization. What we do at the end of the day, we feel good, because it's all about feeling good. If you enjoy what you do, your life will be different. I'm not a psychiatrist, but as a sufferer through the system and also beneficiary of the system, I just give that small comment. Thank you so much. I appreciate
And,
it.
and thank you, because what you just said is very substantial, because what has been noticed in studies that actually lead to that thin line going into depression, some mental health, right? And the suicide, it goes beyond, you know, leading you to burnout, right? More so than just a physical exhaustion. We can just go forever and forever if we have a meaning. If we feel we have a purpose and meaning, we can go forever. That's the way we're built, right? But when you don't have the emotional support, you feel demoralized, or you feel that there's no purpose and meaning anymore. That's when you break. Yes, you hit it right. Yes.
And in
So
the Latin hospital system, I'm working as a ombudsman, and a lot of time I am getting all the information actually relate to this particular issue of burnout, because there is a less amount of people are listening, and it's needed to listen to them, who is actually going through or in early stage of the burnout. And once I listen to them, it's not that they need a special diet. They don't need any special parking place. They're actually having problem with themselves to adjust from another environment to new environment, and they're getting through every day 20 patients, 30 patients, and documenting that they cannot have sleep enough. So they are actually ventilating. So that's why I able to solve many problems by just listening to them. That if they can come in, get up, listen, let me see what I can do. Smile, jokes. I even said to the residents that you should be in the journal club, you should have a smiling club. So the paper of that. So thank you.
thank you.
Next one.
It's not this one. Oh, that's it. Sure.
Hello everyone, we will take a short break of about 10 to 15 minutes and then we'll join for the second topic on therapeutic advancement in psychiatry. Thank you so much for listening to us.
Yeah, that's me.
We're gonna take a break.
Yes, we're gonna take like
Sorry.
coffee break and then after
Only
Okay.